Hey everyone, in this video we're going to be talking about the coronavirus and specifically how it has affected Africa or not affected Africa, opposite to what we thought at the very beginning. At first we thought it would come to the continents and in countries where I am like Benin, there will be tons of deaths, people will be dying on the streets, but that did not happen. There has to be a reason. Today we try and unpack that, talk about some of the reasons we've heard and what we think about those reasons. Without much further ado, let's talk COVID-19. So, as I was saying, we're going to be talking COVID-19, and I'm here with Wisdom. So,
Hello.
Wisdom, tell us COVID-19, what do you think about this virus? Did it affect you in any way at all?
I would say it affected me just a bit, maybe with the hygiene, the initial restrictions in the
Hmm.
country. Couldn't go past certain regions. But besides that, I wasn't affected that much. But
Okay.
yeah, but I know it caused a lot of mayhem around the world and even in some countries in Africa.
Hmm. Yeah, a bit all over. I remember back then I was watching news from the United States. I was seeing that in New York they were bringing refrigerated trucks to a certain hospital. I don't remember the name of the hospital, but to actually put people that were dying in those refrigerated trucks because there was not enough space to keep them where they were supposed to be. And I remember back then I was thinking if we had such a response or such a problem here, there would certainly be people dying on the streets. Luckily, that did not happen. There was no one dying on the streets. In fact, we have a really good case record from what I remember. I think uh, about 5,000 people were infected, but I believe there were about 300 and maybe 70 deaths from
Yeah.
those 5,000 people.
So the last time I looked at it from just a little above 5,000, so maybe 5,300 cases.
Yeah.
In Benin, we have like 80, 81 deaths. Yeah, since
Mhm.
last year. So,
Yeah. So a single death is a bad thing, but we've been able to manage it, I think. And maybe some of the credit goes to the government. When it all started, they, I guess they realized really quickly that it might be a good idea to let people keep working, especially because out here, people can't leave for a very long period of time if they're not allowed to go and work. So it was sort of a cost benefit analysis to see what was worse. Would the virus killing people be worse, or would people dying of hunger be worse? Because lots of people out here live on sometimes like 2 meals a day.
yeah,
So you can't ask someone who lives on 2 meals a day and already doesn't make enough money to feed himself to be in lockdown. That would have been a disaster.
and the economy is not robust enough to cater for those
Yeah,
people, like giving them a monthly pay or
yeah.
whatever.
There's no way of doing what they've tried to do in the US, for example.
Yeah,
Well, tried because it's not like it was all the time.
true.
You can't, whether you can't live on $1,200 for
It's
6 months. That doesn't work.
yeah,
So you need to have some money
save
on
up.
the side. But then not lots of people died, and there are lots of reasons that were put forth. One of them was the age factor. What did you hear about the age factor?
Yeah, about the age factor during my recent research, I because age is a risk factor for the COVID-19 uh, disease.
Yeah, so the older you get, the higher the
The higher the
chances you'll get
chances.
the disease, and also the higher the chances you might die.
So generally in Africa, we have a very young population
Hmm.
of, take the average, it's around 19 years.
Yeah,
Whereas in North America, in Europe, it's around 45, 47 years.
true.
So that could have been a major factor.
I think one interesting thing also is that the younger you are, the less chances you have of being obese, of having diabetes, hypertension. And
Yeah,
so those were also problems over there.
yeah. Because most times as you grow older, there are certain activities you tend not to do,
Hmm.
especially in our context when you're growing old. There are some things you tend not to do, or food you do not want to eat anymore, or
Hmm.
places you used to go to, and since you are older, maybe you've
Yeah,
gotten a vehicle you've gotten, so you tend not to be
yeah.
physically active as before.
Hmm. Yeah, that's what I wanted to come to too. That another thing is as you get older, you tend to get less active. And sports would definitely help your immune system. And the
Totally.
younger you are, the more energy you have, the more likely you are to be moving from one place to the
To the
other. You're
other.
maintaining your blood flowing through your veins. So I think maybe one thing that they could have done at the beginning of the whole pandemic was try and see the best ways to promote safe sports. That may have helped a little. I don't know how much. It's not like I've read any papers on that, but I think that might have been helpful.
Yeah, I thought actually it would have been the perfect scenario for most government or Ministry of Health to promote the fact that physical activity and diet, especially, are very essential to one's well-being.
Yeah.
So, and a lot of us, especially in our context, it's it's quite hard. Even me, you are
Mm-hmm.
looking at it's quite hard for me to go properly to a gym and
Mm-hmm.
work out. But yeah, just walking for a certain number of kilometers
Yeah.
each day, that could contribute to you
Mm-hmm.
having good health.
Yeah. Because I think also if you it was well, it's a respiratory problem. So I guess if you go and you do some sports, the fact that you're breathing a bit more heavily,
Yeah,
what's probably going to tend to happen is your body is going to be using that opportunity to also get rid of some toxins. Even as you're sweating, you're also getting rid of toxins. So that's probably a really good thing to do to help with all of this. And also being outside also means that you have more air around you, which dilutes viral particles. So that instead of being just crammed in one space, you have less of an issue. And I think also, actually, I'm just thinking about it now. One thing other than that may be that in our countries, we usually don't have central air systems.
oh yeah, yeah,
So
true.
it's not like you have a central place where all the air is going through and you have connections between one room and the other. The room in which we are right now, for example, it's all concrete
Yeah,
and it's not linked to any other room. If you want air, you open the window.
yeah,
Yeah.
true, true. Yes, it's a very important factor as well because there were some studies that showed that the SARS-CoV-2 virus tended to the rate of transmission tended to be increased indoors than outdoors.
Okay.
So that could have been a factor. And thinking about outdoors as well, if one went out, if the one was outdoor quite early in the morning, because that's the period when you have sunlight, and
Okay.
the sunlight, it's this period you have the ability, your body has the ability to use
Make vitamin D.
the
Mhm.
rays from the sun to make vitamin D. So that also might have been a factor.
Yeah.
Yeah, because in Benin, just to put things in perspective, we're not in lockdown or in a very restrictive lockdown as the
Yeah.
rest of the world. We're more strongly advised that if you can work from home, work from home.
Yeah.
Or if you have to go to work, just make sure you have your mask, you wash your hands, like
Yeah.
the 1 meter
Yeah.
distance. So,
Essentially, every business was made to buy different sorts of systems. You could buy whatever you wanted, but you had to buy a system to ensure that anyone that got into your place of work washed their hands before actually getting in.
yeah, or you just had a hand sanitizer.
Yeah.
Yeah.
And then we also have open markets. I don't know whether that's a good thing or a bad thing, but luckily they didn't participate in the spread of the disease, so we're lucky in that sense. Now, we won't yet go into chloroquine and all the other medications. I think the jury is still out on that. People are still doing research, trying to figure out how those work. Some people have said they work, some people have said they don't work. We don't know yet. But I think the main thing to keep in mind is if ever there's anything of this magnitude again, I mean it's still affecting us, but one big thing would be just ensuring that we eat we eat well, ensuring that we do some sports, and that would go probably a long way helping us in helping keep us healthy.
Yeah, and even resting well, sleeping well, because definitely I'm sure that during this pandemic, maybe a lot of people must have been, uh, based on what they must have seen on social media, must have been very scared, and that could have caused stress, that might have prevented them from sleeping.
Yeah,
And
pretty much.
so,
Yeah. So, we hope you've been able to learn something from our discussion. If you found it interesting, if you think you know anyone that could benefit from this video, make sure you share it with your friends. Like and also comment if you have any questions or if there are some points you think you'd like us to expand on, or if you have a different take on anything, also comment below so that we get your ideas and we can talk about them also probably next time. So